So this chapter is going to focus on oncology. So we're going to be looking at the pathology around cancer, the signs and symptoms, and what we're going to be looking at are some specific forms of cancer. There's going to be other forms of cancer that we talk about kind of in throughout the other chapters. I mean, obviously you could get cancer within kind of any body system, but what we're looking at here are some specific types, and again, just going over the signs and symptoms. Again, as an athletic trainer, one of the things you have to be aware of is, again, many times, again, as our primary focus being on assessment of, orthopedic injuries, sometimes, again, some of the early signs and symptoms, there could be some things that maybe, the patient doesn't assume to be associated with what's going on with their, a complaint that they may have. And, you kind of put things together and find out that, there's something a little bit more there as far as what's actually wrong with them. So we're going to talk about some of the things to kind of look out for, and then kind of how to go about referral and management. Okay, so just kind of an overview. So the pathophysiology of cancer. So again, you can get cancer essentially in any body system, okay? So, I mean, again, we're going to talk about some specific forms of cancer here, certainly not all encompassing. We'll we get into the other body systems, we'll make mention of some others. But basically, when you look at the pathophysiology of cancer, this is where we start to get into malignant cells. So, you associate cancer with tumors. The thing to remember is not all tumors are cancerous. Okay, so a tumor is really just defined as an abnormal accumulation of cells. Now, where you get into cancer is where you get into what we call a malignant tumor, okay, where they're non-specific cells, they're uncontrolled growth, and they become invasive and get to the point where they start to interfere with organ and other cell function. And part of, one of the reasons why we think that cancers form is through what are called carcinogens, which are things that cause chromosomal defects, and they come from things like within the environment. So, here we kind of see just in the little picture kind of showing the mutation that occurs and how you end up getting that. So you end up getting, again, this uncontrolled growth of cells. So as far as the diagnosis of cancer goes, again, it's based on the metastasis. So, they look at, when you look at the prognosis and how, individuals with cancer will be treated and, what life expectancy would be. It's going to be based on how the metastasis occurs, if it spreads to other body regions. We'll talk about the staging of cancers briefly, so you have an idea of that. So risk factors, again, there's many risk factors to different forms of cancer. So obviously a positive family history is a very big risk factor. Smoking, high fat, low fiber diets, chronic alcohol use, prolonged exposure to sunlight, psycho-emotional stress, your occupation, your gender predisposes you to certain cancers. So there's many risk factors that take place here. Again, significance to athletic training, again, you should be aware of common cancer treatments. It wouldn't be unusual to have a patient undergoing a cancer treatment so that you understand the precautions, the contraindications associated with physical activity and rehab. So it's good to be aware of that. Plus, as an ATC, you can play a key role in cancer prevention. You could play a role in early detection, educating patients. So again, we don't think of this as being something, but it is. It's under the what we do, and certainly there's preventative things. Take something as simple as like with skin cancer. Maybe you're doing an evaluation and you happen to notice a mole that has some of the characteristics, and you start talking to the patient about it, and that kind of gets them to go and get it evaluated. So that's where the role of the athletic trainer would be with that. So there's certainly a part to play here when it comes to cancer. So our general signs and symptoms, so things to kind of note about cancer. So a fever, again, not caused by like a sickness or anything of that sort. And again, that's going to be because of the increased metabolic demand, fatigue, Lymphadenopathy, you see that many times with lymphomas, so enlarged lymph nodes. Symptoms at night. So this is one of the things you want to watch out for, particularly when you're, again, evaluating for somebody who, again, they think they have a, orthopedic issue or a structural issue, for instance, someone with back pain, if they're saying, well, it wakes me up at night and I can't sleep. That's a red flag. Again, it doesn't necessarily mean they have cancer, but it needs to be ruled out. You should be making sure that there's nothing there, and there would be diagnostic tests to do that. Kind of a cyclic pain pattern, so a pain pattern where it's kind of off and on. Unusual muscle and joint pain. So, again, as I said with some of the earlier discussions, so look at that algorithm in your textbook, because that kind of takes you through. If you have this unusual muscle and joint pain, what are you looking for? It'll take you through the, kind of process of, when do you refer, how do you treat them? So again, anytime I cite anything like that in a discussion, please go back to your textbook and just run through that. And they have what are called the 7 general warning signs. It goes by the mnemonic CAUTION. So CAUTION. So caution, okay, it starts with C, change in bowel or bladder habits. A is a sore that does not heal. U is unusual bleeding or discharge. T is thickening or lump in the breast or elsewhere. I is indigestion or difficulty swallowing. O is an obvious change in a wart or mole. N is a nagging, persistent cough or hoarseness. So that's kind of something that has been put out there as kind of like a general, screening that the everyday person could think about, any one of those things. And if you think about all those things I just discussed, it kind of encompasses, like, most of the body functions throughout, the different systems in the body. So any of that would constitute, at least a discussion with a physician. If a patient came to you with that, you'd obviously want them to get referred to a physician for further testing. Okay, so when we look to stage cancers, so we do this, what's called the Tnm staging. So T refers to the size of the tumor. N involves the involvement of lymph nodes. So, did the cancer kind of spread and then get into the lymph nodes? And M is metastasis. So how is it kind of moved throughout the body? Has the tumor gone to, have you started to have tumors form in other regions? So that's what the TNM kind of stands for. And then it gets basically staged based 1 through 4. And I just have a picture up here of, you can see the illustration of what the first 3 stages is. And basically, you look at how, again, how big the tumor is, how invasive it is. And you're not going to be responsible for staging this. This would be something that an oncologist would do anyway. But it's good to be familiar with it, so you at least have an idea of, say you do, again, someone in your, your patients, your clients ends up with this, and you read a physician report, at least you can understand where it comes from. And then the prognosis is going to be based on that. And with cancers, they're typically, the prognosis goes in terms of 5-year survival rates. So they basically look at, once a person was diagnosed, within 5 years, what's the survival rate. Important to note, though, a lot of the cancers within the blood and lymphatic systems don't form tumors. But basically, those interfere with the function of normal. They still interfere with the normal function of tissues or cells. So that's an important thing to know. So those types of cancers, you don't necessarily have tumor formation, so those would kind of be dealt with differently in that regard. As far as metastasis is concerned, the common sites where metastasis will occur from other forms of cancer, the spine, the lungs, the brain, the liver, are some of the more common areas where cancer could metastasize to. So in other words, the cancer didn't start there, but if it was an aggressive cancer or it wasn't found early enough, that's where you would end up having that occur. So for the exam, again, the history, again, you want to kind of see what their signs and symptoms are, what complaints do they have, is there anything unusual? So, you want to keep an open mind, even if they start talking about, and again, I'll just use the example of, low back pain. Well, they have low back pain, but they've also been fatigued a lot and they've had a lot of night pain. That would lead you to, not necessarily just start treating them for structural low back or mechanical low back pain. You would want, probably at the very least to have a conversation with your supervising physician about that. Inspection and palpation. So again, look at the changes or size and the appearance of moles, any tender swollen lymph nodes or any type of palpable masses. Make sure to kind of inquire about in as far as, how those should be looked at. Now, as far as treatment, again, here I'm just, looking to give you a basic idea so you at least have an understanding and appreciation for what would go on. Again, in most instances, you're still going to probably want to have conversations if you're ever dealing with a patient that has cancer from, dealing with them from another rehabilitative standpoint. You have communication, obviously, with the physician if any questions would arise. So obviously, you surgery where they just basically go in and remove the tumor, okay? And there are certain instances where even with a cancerous tumor, they could go in, remove it, and for the most part, the individual will be fine at that point if it's caught early enough. Radiation could be used, so basically they just use high energy X-rays or other form of radiation to basically attack the cells, for lack of a better way of putting it, and prevent them from proliferating. So a lot of times they'll do either externally or internally applied radiation. So externally, they'll actually just use like a high-powered X-ray. Internally, they'll actually implant little radioactive either needles or what almost appear to be like little seeds into the body, and basically get it around the target tissue. This a lot of times, individuals can experience like fatigue, so that would be whenever they're getting treated like this. Chemotherapy. So chemotherapy has a little bit more systemic effects. So, again, what basically happens here is you're basically getting infused with a medication that basically will go and destroy the cancerous cells or the tumor. The issue with chemotherapy is that it doesn't tend to distinguish normal dividing cells from the cancerous. Now, chemotherapy has come a long way. There's probably advancements that, at this point even, I'm unaware of, but, there's still side effects to the type of chemotherapy, and there's different regimens based upon the cancers that people have. But many times people will still experience nausea, fatigue, memory problems, neuropathies, impairment with red blood cell production, and again, you commonly, some of the common things people think about are, for instance, people losing their hair and things of that nature. So, and the reason why is like things like your hair, your nails, your mucous membranes are made up of rapidly dividing cells. So the chemotherapy, again, doesn't distinguish between the normal cells from the cancerous cells. So there's the tendency for that to occur. There's other types of therapies. There's immunotherapy, which again kind of allows the person to use their immune system to fight the cancer. There's something called anti-angiogenesis, where basically you're limiting the blood supply to the tumors, and that hopefully causes them to basically deteriorate. So the thing you want to realize is that you want to think about how these different things would affect a physically active individual. So obviously, and most people are just even aware that, many times people undergoing a lot of these treatments are going to experience side effects. But again, from the standpoint of the individuals you'll deal with, be thinking about how that would impact them. Okay, so here we get into our condition specifics. So what you're going to be doing here is for every condition that has a little asterisk next to it, you're going to be including those signs and symptoms in the chart that I give you, and then talking about the treatments. Okay, so I'm not going to get in depth into those things in these discussions. I'm going to make you responsible for doing that, and again, I think it'll just help you remember them more, as opposed to me just kind of listing them within a talk like this. I'm just going to give some background on the conditions. I may throw in some signs and symptoms just for context, but make sure to do a more thorough review of that. So leukemia is a cancer of the bone marrow cells where individuals will have issues with red blood cell production. The actual condition itself increases the production of immature white blood cells. Now, again, that will affect the other blood cells. As I said, you'll have issues with red blood cell production. It also does affect the platelets as well. This is one of the cancers that's not staged because, again, you don't have tumor formation with it. This is strictly just a cancer within the blood. And there's differences between acute and chronic, and you can differentiate that with the signs and symptoms as well. Acute forms of leukemia have a really fast deterioration, so those need a much more prompt and aggressive treatment, whereas chronic, many times people with chronic leukemia, depending upon kind of the nature of how it forms, can lead to complete remission in many patients. So that's something to make note of with the acute versus the chronic leukemia. Hodgkin's lymphoma and non-Hodgkin's lymphoma. So these are both cancer within the lymphatic system. So Hodgkin's disease is a malignancy of the lymph nodes. Many times can metastasize to, again, some of the areas we talked about before. The liver, the lungs. It can metastasize just to bone in general. The spleen is also another site where Hodgkin's lymphoma can metastasize to. Hodgkin's disease is fairly treatable in most people. That's as opposed to a non-Hodgkin's lymphoma, which tends to be more widespread and aggressive. And this could also form in the B and T cells within the immune system. So one of the things to note in the differences between the two is non-Hodgkin's lymphoma is a little more difficult to treat. So an osteoid osteoma and an osteoblastoma, these are actually both, these aren't cancers per se. So, some of the things when you're kind of looking at these is to kind of understand, what are benign versus malignant tumors. The difference in kind of denoting these is the size. Okay, so you have, an osteoid osteoma is the smaller version, the osteoblastoma is the larger version. And just make note of your common sites where you would see these. But these are benign tumors. Now, benign tumors in the bone, that's what these are. They're basically bone tumors. Can still cause problems. They could put pressure on nerves and cause pain and things like that. So they'll typically still have to be dealt with. Osteochondroma and chondroblastoma. So again, if you think about when you're looking at terms, so osteo refers to bone, chondro refers to cartilage. So again, these are also benign tumors as well, involving the bone and the cartilage. Now here we're going to look at malignant tumors of the bone, so an osteosarcoma and chondrosarcoma. So an osteo bone, chondro cartilage. So these are now your malignant tumors. The osteosarcoma is more common in younger individuals. So this would be something you would want to kind of keep an eye out in younger patients. Obviously, a lot of cancers aren't common in younger individuals or just don't happen in younger individuals. This would be one you'd want to be concerned about. So, particularly if you get a really young, if you're dealing with a really young population, high school, even junior high school, and you get, kind of, some funny bone discomfort that doesn't seem to make sense, it would be a good idea to make sure to, again, refer that on to see if maybe some further studies would be necessary there. The chondrosarcoma is going to be more likely in older individuals. Interestingly enough, chondrosarcomas are a little less likely to metastasize. So again, the cancerous tumor strictly involving bone would be typically something you'd see in younger people. And some other specific pediatric issues, which we'll mention pediatric issues throughout the course of the semester. So acute lymphoblastic leukemia. So we'd mentioned how acute leukemia is again something that requires a much more prompt treatment, and the individual can deteriorate very fast. this is a form that, an individual could get in early childhood, and it's a medical emergency. So the individual that, the young child will start to show, when you look at your signs and symptoms, they'll start to show them. It'll be very aggressive early on and requires them to, get immediate treatment to prevent, problems. Ewing sarcoma is a malignancy that occurs before the age of 20. So this is a cancerous tumor. Again, it involves the bone. You can see a picture of it here. It most commonly happens in the lower extremity. You can see a picture in the illustration that I have over here of the Ewing sarcoma. Again, you get an athlete, or we'll just say a patient with kind of funny bone pain, maybe not even brought on by a trauma, and you could probably even feel the palpable mass. It would be something you would want to look into, particularly for a younger individual, because a lot of these bone cancers are things that can happen in the younger population. So these are your learning outcomes. So, and again, for the conditions, and this will be something that you do throughout the semester, you'll use that conditions review sheet, put all the conditions I discuss, go through, do a more thorough look at the signs and symptoms and the treatments as well, okay? And again, the treatment options, you don't have to really know in depth. I mean, it's not going to be up to you to decide the treatment of an individual that has cancer, but you have to at least know and understand how they're treated, and kind of know and understand what that would mean for the individual that you'd be working with.